In this video, we'll be learning through questions about infection control. This is just part one. The topics are who needs the private room and making appropriate roommates. So when the question pops up, I will read it to you. Then I will give you a few seconds to think of what you know about the question. Then I will read the options and we'll discuss why the answer is best. If you'd like more information about these topics, you can usually find them under the infection control, foundations, or fundamentals areas of your nursing resources. So let's get started. Question number 1. The charge nurse is deciding which of the patients should be placed in the private room. Which patient should the charge nurse select? Number 1. A client status post a bone marrow transplant. Number 2. A client with methicillin-resistant Staph aureus or MRSA. Number 3. A client with Addison's crisis. Or number 4. A client with hypothyroid. And the answer here is number 1. The thought for the private room is that private rooms are for those with immune system suppression or overactivation, which is an autoimmune exacerbation. If you pick number 2, that's usually the way the hospitals do it. But if you think about it, if somebody has MRSA, they can be roomed with somebody else with MRSA because they can't infect each other. So to take up private rooms with people with MRSA really doesn't make sense. And so in the further learning, it's a good idea to make sure that we know who those immunocompromised people are. And so there's some examples down here. Cushing's is immunocompromised. They make too much natural cortisol, which is basically steroid. So they're in an immunocompromised situation. Just remember their partner, Addison's, is not immunocompromised. Endocrine partners are opposites. Continuing, other immunocompromised examples are neutropenia, leukopenia, agranulocytosis, bone marrow suppression. Remember, white blood cells are made in bone marrow, so anything affecting the bone marrow causes risk for infection, and that's why we picked the bone marrow transplant as our answer. Leukemia, aplastic anemia, both of those mess with the bone marrow. Chemotherapy, radiation to bone marrow would also be included. Immunosuppressive therapy, like somebody post-transplant might be on cytotec. HIV/AIDS, especially if it says their CD4 count is less than 200, they don't have a fighting immune system. And don't forget about your pediatric patient with cystic fibrosis. Cystic fibrosis, the genetic disease that causes that child to make a lot of mucus in their lungs. And if they have a lot of mucus in their lungs, they're a perfect reservoir for bacterial infections, risk for infection. Your autoimmune clients, this one might be a little bit tricky. We want to keep them by themselves as possible too, because they're in an autoimmune flare-up. Their immune system is overactive and attacking them. And if you put them in a room with somebody contagious and they catch that pathogen, that could make their autoimmune issue flare up even more when we're trying to calm it down. So it does make sense to try to protect them as well. Your examples here are multiple sclerosis, lupus, Guillain-Barré, myasthenia gravis, maybe in the extreme cases of rheumatoid arthritis, Graves' disease, Crohn's, and ulcerative colitis. Also, please make sure you understand these diseases mentioned on these slides. You should know what they are, you should know how they present, and you should really know how to treat them. Number 2, the charge nurse is assigning rooms to new admissions. Drag and drop in order from the client that needs the private room the most to the client who needs the private room the least. Number 1, a client in Cushing's disease. Number 2, a client experiencing a lupus flare. Number 3, a client infected with VRE in his wound. Number 4, a client with diabetes type 2. The thought here is that, again, the private rooms are reserved for those with immune system suppression, then overactivation or autoimmune issues. So in order, it is 1, 2, 3, 4. The slide here has the final private room hint. If you want to take a screenshot, immunocompromised is first, because remember, they're going to be on reverse isolation. We're putting them in a private room, and we're trying to avoid bringing any pathogens in that could infect them. So we're gowning, gloving, masking to go in that room. Then if we don't have anybody immunocompromised, then autoimmune would be second. And then finally, if nobody in the list is immunocompromised or autoimmune, then we would go with our infected patients, the MRSA, VRE, TB, because really they don't need to be in private rooms. if we have another person in the hospital, which I'm sure we will, with MRSA, they can be roommates. 2 people with VRE, they can be roommates. 2 people with COVID, they can be roommates. Number 3, which patient would be the best roommate for a 14-year-old male patient with Cushing's? So now we're talking about roommates. Is it number 1, a 16-year-old female patient with bronchitis? Number 2, a 12-year-old male with Cushing's? Number 3, a 14-year-old male with Crohn's? Or number 4, a 17-year-old male with hypothyroid? And your answer here is number 4. So remember, Cushing's is immunosuppressed. So we don't want to put that patient with anyone who might give them something contagious. So the thought is protect that patient's immune system and stay away from contagious patients, and also stay away from other patients that have immune issues themselves. So that is why number 4 is your best answer. If you chose number 2, a lot of students do that. They just match diseases. These questions take more critical thinking than just matching diseases. Just because patients have the same disease does not automatically mean they can be roommates. If they both have immune problems, you should keep them apart. I mean, imagine if you put the 2 Cushing's patients together and then one roommate caught something because they're immunocompromised, how quickly would it spread to the other roommate because they have Cushing's and are immunocompromised too? So just be careful. Think about protecting people's immune systems. And you can see in this picture, if you're looking at the video, how close these roommates might be and how easily that spreading infection from one to the other could happen. Question number 4. Which patient would be the best roommate for a patient status post a gastric bypass? Is it number 1, another patient post-gastric surgery? Number 2, a patient with gastritis? Number 3, a patient in with chest pain due to coronary artery disease, which is CAD? Or number 4, a patient being treated for a myasthenia gravis, which is MG crisis? The answer here is number 3. So remember again, we need to protect the patient's immune system. This patient being status post-surgery is at risk for infection. Try not to give him a roommate who is contagious or has immune issues themselves, like that myasthenia gravis patient. And also, remember, just because somebody has a similar issue, don't put 2 GI surgeries together if you can help it, because they're both at risk for infection. And just because gastritis is a GI condition, don't match GI to GI, again, if there's a risk for spreading infection, which gastritis, we don't know why that client has the inflammation or infection, so they should not be made into a roommate as well. So final learning here, reminder, the answer is number 3, and just because patients have the same surgery or system area problem does not automatically mean they can be roommates. Use your critical thinking skills, and if they have immune problems, try to keep them apart. Question number 5. Which patient would be the best roommate for a patient with MRSA in his diabetic ulcer? Is it number 1, a patient with vancomycin-resistant enterococci, VRE? Number 2, a patient with methicillin-resistant Staphylococcus aureus, MRSA in his blood? Number 3, a patient with diabetes? Or number 4, a patient who is in congestive heart failure? Now, the thought here is because this client has MRSA, you do want to find a roommate that also has MRSA. So same pathogen is fine to make into a roommate. What's a pathogen? A pathogen is a bacteria or a virus, because if one has MRSA and the other one has MRSA, they can't infect each other. So same pathogen is fine, but not necessarily same disease process like we saw in the other questions. So final thought here, the roommate hint to getting these right is at the bottom of the screen here. Same pathogens can room together, like MRSA, VRE, TB could even room together, 2 people with COVID can room together, but the same disease process, not always. If asked to make a roommate of somebody with an immune issue, do not choose anybody who has an immune problem like immunocompromised or autoimmune. Also stay away from people with loose stool, and of course stay away with someone contagious if you're trying to protect somebody's immune system. Hope you liked this video on infection control, private rooms, and roommates, critically thinking and learning through these questions. If you like this content, subscribe to our channel. Please remember to like this video, and you can always find us at sciencestrategies.com.